I want to bring in my panel this afternoon, Shadow Assistant Treasurer and Liberal MP Tim Wilson also. Welcome to both of you. Tim, I'll start with you, Stephen Jones, of course. It's only been a few weeks, but a lot has changed in Victoria since you were last on the panel. In Victoria, of course, Melbourne is in lockdown, so is the Mitchell Shire. Do you think we're getting to a point now where the state looks like it can kind of squash this, flatten the curve again in this 6-week period?
It's hard for somebody like myself to judge. Obviously, the state government and the Commonwealth are taking advice from medical authorities, but what this outbreak to me has shown is that even when you think you're on top of COVID-19, you can't be sure of that. We know is that in the last time we got on top of it in Victoria, the outbreak occurred as a consequence of what was happening or not, in many cases, happening in quarantine, and that has led to this flare-up. Whether we can get, shall we say, the genie back in the bottle remains very much to be seen.
Have you been wearing a mask?
Sorry, could you repeat that question?
I asked you if you'd been wearing a mask. That's the health advice now.
I have a mask, and in certain circumstances I do, but I obviously am not wearing one at the moment.
I noticed.
We have taken appropriate precautions in the event that's necessary. But like a lot of MPs, we've diminished or minimised the impact or the engagement we have with the community beyond making phone calls or Zoom-based phone calls to make sure that we can protect community health and lead by example as much as possible.
Stephen, we're now seeing clusters pop up in New South Wales. What's your reflection on this? You saw what happened in Melbourne. Are you worried that's about to happen in Sydney?
I look deeply worried. Can I first say to Tim and I, who are often sparring over many things, our thoughts and our hearts go out to all of our colleagues across the political divide. Everybody throughout the state of Victoria, we can't imagine. In fact, we can imagine what they're going through, and it's terrible. If anything, a wake-up call to us right around the country to ensure that we double down on all of those public health measures, social distancing, washing your hands, doing all the things that are necessary, and avoiding crowds and testing when necessary. Yes, we're worried. We're very worried. We want to ensure that we put all the measures in place to ensure that we don't go through the same thing that they're going through in Victoria. We don't want a school, a business, a public place to be locked down any longer or any further than it needs to be.
Sure, but is there a certain inevitability that we're going to see, Stephen, a shutdown of a local area, or should that happen to try and contain this virus after you've seen what happened in Melbourne? Clearly this virus spreads in the most extreme way. The Premier in Victoria, I think, rightly describes it as a bushfire. That's how it looks. Isn't that a bushfire? You can see the fire coming towards you. Are you getting to the point where you're thinking, hang on a minute, we need to lock things down?
Well, to continue your fire analogy...
well, I borrowed it, to be fair, from the Premier.
It's the best thing we can do, putting in place the sorts of measures now that will prevent that occurring down the track is the best thing that we can do. But yes, of course, if we see the sorts of numbers that are being experienced throughout the state of Victoria at the moment, then you'd expect the same public health measures to be put in place.
Tim, could the shutdown of the 9 public housing towers in Melbourne have been handled better? I know there's been criticism of that, of the process that was gone through. On balance, do you think it was the right approach?
I've no doubt that things could be done better, but I do think we need to be realistic, that lots of decisions are being made as events unfold and with a limited amount of information. This is the challenge of this virus, is it isn't just an ordinary virus where you can get symptoms identifiable within a couple of days. Often the lag time or the latency period can be a couple of weeks. And so we can go through the various criticisms of government policy, and people will have that. The truth is, I don't think we'll know the answer for about 2 years as we compare the conduct and policy decisions, not just of our governments, but also of foreign governments, and what worked and what got the balance right. The main thing is to make sure that those people who are in those towers, and I think in the same way that Stephen said before about other people across Australia having sympathy for Victorians, I think most Victorians, as I'm sure most Australians have is sympathy for those people who are in those towers, and that maximum support is provided to them because they're not just protecting their own health. In practice, the lockdown they're experiencing, which is very challenging, is protecting everybody's health because of potential risk of exposure that they could give to the rest of the community.
Do either of you think, and I'll start with you, Stephen, that perhaps the strategy should change? I mean, we heard from the Chief Medical Officer in Victoria, Brett Sutton, that perhaps eradication should be sought. And I want you to put your economic hat on, if you can, Stephen, to answer that, because what we've seen, at least in Melbourne, and I'm broadcasting from Melbourne, is a stopping and starting. So the economy gets shut down twice. Would it be better to do it once and do it properly?
Look, the best economic response is a perfect health response. A perfect health response is ongoing and permanent prevention of the spread of the virus, firstly through a vaccine. That's a long way down the track. If we can eradicate the virus from Australia, if that were possible to do, then that'd be the second best scenario. The third best scenario is learning to live with it.
So you would prefer, sorry to interrupt, but you would prefer eradication at this stage?
Look, as I said, best thing from an economic point of view and from a health and a societal point of view, vaccine, prevention, eradication if we can. There's only one country in the world that I'm aware of that's succeeded in eradicating, and that's our neighbours across the ditch.
Do you think we can be like New Zealand?
Achieve that. Sorry, I missed the question.
Do you think we can be like New Zealand?
I think it'd take a lot of significant restrictions for us to be able to achieve that. I think we're best taking our advice from the public health officials on that. As I've said to you and others on numerous occasions, we can talk about the economic implications, what we need to do to put in place measures to help households and the economy through, but health advice best taken from the health experts.
Yeah, look, there's no doubt that the health experts have been guiding this process, Tim Wilson, but now we know the facts. We know what eradication versus suppression looks like. And of course, all decisions are made with a risk analysis of you know, what the impact on the economy would be too. That's been clearly the way that this has been thought about, with the economy opening up and the plan nationally to do that. Tim Wilson, do you think it's worth revisiting that strategy? Because clearly not only would the health outcome be better, but economically, you wouldn't see this stop-start, would you?
Well, I think we need to be realistic that all scenarios carry risk.
Yeah.
Even though New Zealand has gone down a pathway of eradication, in reality that means they have completely closed borders, which means that lots of sectors of their economy continue to suffer and experience pain as well. I guess the way I look at it has always been, what can we practically do that's sustainable? And I don't have a perfect answer for this, but I think when we have measures like social distancing, we're now seeing the adoption of masks, particularly if we're going to have to live with this virus for a period of between 1 and 2 years, and that is in itself speculative. It's how do we do things that are sustainable and get that proper balance between lives and livelihoods right. And yes, it has to be heavily informed by the public health response, because that's a critical part of dealing with and trying to suppress the virus as much as humanly possible. But as we've seen in Melbourne, that can come along when we least expect it. So I don't think that you want to have a start and stop approach. I think we'd rather have a start approach and keep going, but the health realities sometimes overlay that. So how do we achieve it in a sustainable way?
Tim, during the first lockdown, you wanted schools to reopen. You cited the health advice at the time. What's your view now on schools reopening? They have opened for specialist schools, but also years 11 and 12. But for the rest of the state, right, this week is an extra week of holidays. I can assure you that it doesn't feel like much of a holiday when you're in lockdown for the kids that are at home. But then they go to learning from home, this remote and flexible style. Do you think that that's the right approach?
Well, I think the evidence at the time in the first lockdown was in favour of kids going to schools, and that was certainly what was being communicated by health officials. And I think there's still an engagement and communication. What's changed between this time and last time has obviously been the capacity of schools to be able to assist and support, but it still puts enormous burdens on parents, and I know you're in this situation as well. So ultimately I think the state government's got it right about year 11 and 12 and making sure they're going back. They'll have to make an assessment about what's right at lower levels, and we have to continue to take information and guidance from health officials about the risk, because one of the things that's become clear about this virus is not just obviously that it presents enormous challenges for us economically, but it in of itself is not straightforward. I know Brett Sutton, the Victorian Health Chief, identified that the current strain, if I understood what he said correctly, the current strain that's being communicated across the community is not the same as we experienced during the first wave. So it's not even clear that it's necessarily the same strain of virus.
I want to bring you in on that, Stephen. Obviously, schools has been a big issue in New South Wales. I think you're still on school holidays, aren't you? But you certainly will go back at this stage. Anything can change, though, if the outbreak gets worse. Is that something that concerns you? I mean, it's clearly very disruptive in Melbourne. A decision's been made on the basis of transmission and risk, which the health authorities have asked for, and I think that makes sense. We've been taking advice and implementing that. But is that something that you worry about, again, with your economic hat, in terms of the educational outcomes, the longer-term outcomes for students?
Look, deeply worried about it. You know, I remember talking to my daughter the week before New South Wales schools closed down. She was excited about the prospect of not having to go to school for a protracted period of time. 3 weeks in, she couldn't wait to get back because of the social aspect as well as the educational aspect of being at school. As good as our teachers are, as good as our education system is, there is no doubt that education slides when our kids aren't at school. There's absolutely no doubt in my mind about that. It's also for the parents who are trying to juggle schooling from home and working from home. It's very, very difficult indeed. Everything slides. So yeah, it has an education impact. It has a productivity impact. But I guess we've got to say compared to what? And the compared to what is the bushfire getting out of control and having this terrible virus spread through our communities, through our schools, through our workplaces. The social, the educational and the economic impact of that is too terrible to contemplate. So, yes, a big problem, but compared to what is even worse.
Yeah, look, you know, no easy decisions are being made at the moment, that's for sure. Look, before we go, Tim Wilson, I want to ask you about the changes to Hong Kong visa. Should Australia have offered the people of Hong Kong a safe haven visa instead?
Well, I think we've got a two-pronged approach. We've got one that obviously focuses on skilled migration, but we still have our existing humanitarian pathway to make sure that if there are dissidents or those who have stood up against the Chinese Communist Party, that they have a pathway to come to Australia on the existing humanitarian program if they fear that they're at risk of types of persecution. So I think we've got the balance right. We've got two pathways depending on the circumstances that Liberal Democrats in Hong Kong feel. And I've said consistently, Hong Kong Liberal Democrats will no doubt feel a lot safer in a country like Australia than it would under the Chinese Communist Party. And that's the basis that I strongly support the actions of the government.
How about you, Stephen? Do you think they've taken the right approach here?
Yeah, look, I've got to say a lot of mixed messages from the government on this one. Late last week, we were hearing messages that they were going to have an accelerated process to facilitate humanitarian replacement here in Australia. Then I saw Alan Tudge basically promoting what sounded like a fire sale for disaffected business people out of Hong Kong. Surely that's not as good as we can do. Surely we can do a lot better than that here in Australia. I think back to the situation under Bob Hawke where he gave a very clear commitment to the people who are in Australia back then, who are fearing persecution if they returned home, a very clear commitment that a humanitarian pathway was available to them. I think we need much clearer messaging coming from the government and a very clear undertaking from the government on this one.
Thanks to both of you. Lovely to catch up again.
Great to be with you.
Thanks, PK.